Hi, I'm Dr. Obaji, and I wanted to address what the word eczema means because I hear this a lot from my patients. And in the derm world, eczema is actually not very specific because many things can have an eczematous type of rash, which to us means that it can be pink and scaly and itchy. Now, the most common diagnosis for eczema is going to be what we call atopic dermatitis, which is an actual condition people have from a genetic disorder, a genetic deficiency of a certain protein we call filaggrin, which helps keep your skin barrier healthy and hydrated. So when we have atopic dermatitis, we actually lose a lot of water through our skin barrier, and that loss of water leads to our skin barrier being extra dry, extra permeable, and certain irritants that land on our skin afterwards can always set off irritation and create this rash that becomes very itchy. Now, that can be addressed by a medical professional through a mixture of topicals that can help restore the skin barrier, and sometimes we might need prescription strength topical steroids to help calm down the inflammation, the itch. There are numerous new drugs on the market to help address the actual pathway of eczema, and those are great choices for people who have more ongoing or more progressive disease, and those new drugs on the market can be tremendous help to people who need stronger medication to address their atopic dermatitis. Other types of rashes that can have this eczematous look include things such as allergic contact dermatitis. Now, this is when you have an allergy towards something that you touch out in the environment. When it lands on the skin, can trigger a very itchy rash, and those can be investigated by a medical professional who can help decide what the irritant or what the allergen trigger is and help come up with ways to avoid it and manage it when you are exposed. Those tend to be found in places that you commonly touch the allergen. So if it's your body, maybe it could be the detergent or fragrance that you use in the laundry. If it's your hands, it could be related to something you're working with at work. If it's the face, again, it could be fragrances or something you're putting on your skin. So allergic contact dermatitis does require a bit of investigation to figure out what the source is and then getting you on a proper regimen to help treat. One of the other more common types of rashes we can see that can be considered eczematous is going to be irritant contact dermatitis. However, this rash can be a little bit more itchy, but more stingy and burny than itchy, and can be related to, again, touching certain irritants that are out in the environment that are now compromising and irritating your skin barrier. But these irritants are commonly found and they're out there, so we need to work with you to figure out what exactly is irritating your skin and how we can minimize exposure. Again, there's certain creams we can use to help reduce the irritation when needed, but if you are dealing with any of these rashes and you're needing help figuring out what exactly it is, come on in for a consultation. We'd be happy to take a look.